I'm Jameel Muzaffar. I'm a consultant in nose and throat surgeon. I specialise in problems of the ear, hearing and balance. So tinnitus is the perception of a sound that isn't coming from the world around you. It's often heard as a buzzing or a ringing, a hissing, though there are some other rarer forms where it can sound like music or it can sound like your heartbeat in your ear. So there are lots of causes for tinnitus, and we don't always find out what the cause was in any one person. Common causes include ageing, noise exposure, exposure to certain medications, perhaps chemotherapy or certain strong antibiotics that are pumped into your arm, but there can be a whole variety of things. Certainly other rarer forms of tinnitus, like pulse-style tinnitus, which sounds like your heartbeat, can be caused by a whole variety of other causes which we could dig into. So to start with, we would normally go through the history. So when did it start? How long has it been going on for? What brought it on? What else was going on in your life at the time when it happened? Whether there are any obvious precipitants, so things that might have caused it, and other issues around, particularly around the ear, but also with people's health more generally. We'd examine the ears. We'd get a hearing test in order to understand what's happening with the hearing and try to understand what sort of impact it's having on people. There are some factors in the history that might influence what we do. So for example, when people have tinnitus just in one ear, very rarely that can be caused by a swelling around one of the nerves that runs between the inside of your ear and your brain. And so in order to check for that, we would normally organise an MRI scan. For pulsatile tinnitus, we might do a different kind of scan. So there's a variety of tests we might do. So often for people with tinnitus, what they're really looking for is to try and understand what's going on and what's happening to them. There isn't a treatment that turns off tinnitus like a light switch, but there are some effective treatments. So sometimes there are problems with the hearing that can be corrected. Sometimes people benefit from hearing aids. Sometimes they benefit from other treatments like cognitive behavioural therapy, often delivered via a smartphone app. So for some people, tinnitus does disappear, particularly when it's very short-lived. You might have been to a loud music event and you get home and you realise your ears are ringing, and in the morning it's gone. That's tinnitus, and that's disappeared. When people have had it for longer, it's much less common that it disappears, and certainly if it's been there for a year, it's very unlikely it will go away completely. What does often happen for tinnitus though is that our perception of how loud it is, how bothersome, how intrusive, that decreases over time, so that hopefully people can get to a position where they might know that the tinnitus is still there, but it doesn't bother them anymore. So stress is a really common factor that plays into tinnitus. People sometimes ask, does stress cause tinnitus? Well, more stress unmasks tinnitus that was probably there already. What stress definitely does is exacerbate people's tinnitus. So if you imagine your tinnitus sort of bumbling along at a 2 or 3 out of 10 level, when people have stress going on, and that could be a physical stress like you're going to run a marathon, or it can be a psychological stress, money worries, family worries, moving house, all of the pressures that we go through in life, those all increase our perception of how loud our tinnitus is. And that happens because tinnitus is governed by our autonomic nervous system, and when that is upregulated, for example by stress hormones, by adrenaline, by cortisol, that raises our perception of tinnitus. And equally, if you go and lie on a beach somewhere, listen to the sea, calm down, that often will help people's tinnitus. So there's lots of reasons that people might seek help for their tinnitus. Tinnitus is really common. It affects between around 1 in 8 and 1 in 12 of the adult population, and that's pretty standard across the Western world. What's different for people is how troublesome they find it. So if you're not finding your tinnitus at all troubling, it's just buzzing and ringing and you've got it in both ears, that's fine, you can leave that alone. If tinnitus is bothersome for you, you're struggling to manage it, if it's just in one ear, if it sounds like your heartbeat, those are all reasons that you should seek medical help. If you've got any questions, you can talk to one of our staff via reception, you can call us on the telephone, or you can use the booking form on our website.